All right. So just a little bit of background on myself. Ben provided some. I spent a decade working at Clorox, which I'm sure all of you are intimately familiar with as consumers. I worked in our hospitals and janitorial and sanitization businesses. And what we did on the professional side was sell Clorox products into those three areas to remove essentially hospital-acquired infections. So 1 out of every 5 people that goes into a hospital exits with something they didn't have when they went into the hospital. And Clorox is very adept using petrochemicals at removing both cleaning and disinfection, as Dr. Wade provided the difference between by removing 99.99% of pathogens on surface. So the big key here is that issues with indoor air health have really not been solved, and none of the large companies have been able to do this. The use of chemicals is very prevalent on surfaces. You do require manual labor, and you do require constant repeat usage of chemicals, which have kind of disastrous effects into the environment. However, air has not been cracked, and it's been a long-standing problem. It really became much more light shed on it over the past couple of years. And you're seeing this as a result of what happened specifically within COVID, that people are aware that pathogens spread through air. It's actually the hardest to crack, and it is where most pathogens spread. And I'm going to show you that. So we really are at a tipping point now where the issue has been forced. When you think about the spaces that we all gather inside, the best of life happens here, right? Humans are social creatures, and we spend 90% of our time indoors. That's for our little ones, our kids. We want to keep them safe in school. We know the importance, as we've seen over the past couple of years, of detraction in test scores. We're really doing a disservice to the future generation. Second, we want to keep our frontline workers safe. So imagine all those people that are protecting our children, ourselves, our aging parents in the hospital setting. They come into contact with so many people every day. And so a patient zero comes into a hospital, 1 out of 5 people that I mentioned contracts something, leaves with it. But then that hospital worker also carries it to all of the other patients in the hospital setting. And she herself brings it home to her family. And then third, we really need to keep our economy thriving. We all know as commercial people what happened when things were put on pause. And so if you think about the need to gather in person, have the public sector functioning, hospitals functioning as they should, senior care facilities safe, schools operating, it's really important to focus on the air indoors. I live in California, where every fall, right around this time, we have terrible outdoor air quality because of wildfires. And so people are intimately familiar with what happens when you feel badly from smoke inhalation. You don't want to go outside. That's why it's so important to treat the indoor air the same way. So what does effective disinfection do? So I think it's really important to consider outcomes. So being 99.99% effective, what this means is our products, the R0 products, can generate the highest effective air changes per hour. And as Ben mentioned, there's been a lot of solutions that have been used historically and also most recently because organizations have really understood the importance of air changes per hour. The most prevalent solution being used right now is heating and air conditioning services. And what those services are designed to do, those systems are designed to do, is heat and cool buildings. So they're not actually designed to push air through the buildings and move the airflow for a safe, effective air change per hour. They're really designed to change the temperature in the room. What happens by running the heating and air conditioning much more is that we're turning off as a country, as companies, a lot of greenhouse gas emissions. So R0 devices run on standard electrical, and we use 5% of the GHG versus the HVAC. We also run about 1/20th the cost of an HVAC system. So many of our customers have seen their heating and air conditioning bills skyrocket, of course, because of the overusage, but also because of the rising costs of energy. One of the large school districts we work with, it's the 5th largest in California, has about 70,000 students. They have a new protocol where they run their air conditioning 2 hours before anyone sets foot in the building and 2 hours at the conclusion of the day. That's really a waste of energy and is really expensive to the school district. So they are looking at R0, using R0 devices. As Ben mentioned, and Dr. Wade also mentioned, this has really come to light, and the CDC and ASHRAE have published standards that are addressing the indoor health across industries. The CDC actually recommends the use of UVC, and ASHRAE has not only drafted the standards, but in record time, they published for public consumption and then the final standards. And what these are controlling for is minimum requirements to stop the spread of airborne infection. So ASHRAE in particular is requiring specific enhanced ventilation during times of high risk. This is code enforceable now for all new buildings as well as retrofits. So as Ben mentioned, there's very specific requirements by vertical, which we're going to go through with all of you in the following installments of this webinar. So you'll know based on your own individual spaces what you need to do to be code compliant. The CDC has also similarly developed guidelines to protect the public health. And so the CDC is recommending at least 5 effective air changes for all occupied spaces. The rooms that you all are in, the room that I'm in an office space right now, on its own is probably running about half an air change per hour. Using an HVAC system gets it up to 2 to 3, and that's running an HVAC system at high usage. So there needs to be something for the minimum usage required or specified by the CDC to get it to that 5. And then as we mentioned, ASHRAE actually requires much more extensive air changes per hour. So when you think about public spaces like hospitals, waiting rooms, gymnasiums, places of worship, the numbers are double digits required for per hour. So I'm going to go through a couple examples to really bring this home to you. So I want to really show you what our solution is. If you think about this, it's a hardware and a software solution combined. So on the right-hand side, what I'm going to show you, the very tall unit is called the Arc. Then you have, and that's a mobile unit, and I'll go deep on that. And then we have 3 installed products that you see on to the left of the Arc, the left of the tower. Those are mounted in rooms. And then on the bottom of the screen, you see our sensors, as well as the dashboard that you all have real-time insights as to what's happening in your indoor spaces. So what my objective is, as someone who's very, very passionate and deep-setted in disinfection, is to really make our shared public spaces safer and provide access to all of you to do that. Historically, UVC has been so expensive that only hospitals and large hospital systems have been able to provide. So, for example, the UVC tower, that tall aqua lighted instrument you see on the right hand of your screen, some competitors sell this for about $160,000. It means that only large-scale institutions could actually invest in this. My objective was to use technology to make this more affordable so that we could democratize access to UVC. And we'll show anyone who's interested can find out about this, but we sell for 1/20th the cost of a competitor. The other things that we do is we provide real-time risk scores to all of you. So taking in all of your own environmental data so you know how risky your space is. And then we do API calls automatically to our installed devices so those devices are used in the most risky spaces. And then we provide the outcomes for you. So you see your effective air changes per hour, you see your ozone layer levels, you see your oxygen levels, you see your indoor air quality, everything, so your indoor space is made smarter and more intelligent for you. So let me show you the products. Just a reminder how pathogens are primarily transmitted. I really talked about this, but it's surface, airborne, and person to person. And each of our products addresses this. So we have solutions that help in all areas. Okay, so here's our Arc mobile tower. So what this is that Aqua product that I showed you. This is used for routine disinfection and room turnover. So our hospitals, our education customers, our public sector customers use this to push through areas where there's been an outbreak, or where the room needs to be turned over. Just last week, one of our school districts had an outbreak of norovirus, and they ran their arcs. They have multiple arcs. They use them across their full district. They ran them for 57 cycles to completely disinfect their locations. So in as little as 7 minutes, ARC eliminates 99.99% of the microbes in an unoccupied room. So this is really perfect for a high-risk space like bathrooms, patient rooms, kitchen, that there's an on-demand disinfection. What I'm really excited about is the installed products, and there's 3. Beam, which is our largest, most efficacious product. Ben talked about this and the genesis of this product, actually dating back to early 1900s. The technology hasn't been adopted widespread. So what this is, and you see it on your screen, it's above the woman having her physical therapy session. What it does is it's the first upper room UV system that can disinfect large volumes of air. And it's typically used between 500 and 1,000 square feet, depending on the ceiling height, depending on the mounting and the configuration. And it can actually be used up to 5,000 square feet. So for any of you who are in a school district and you want to consider, for example, your multipurpose room, your common room, your gymnasium, a beam could be mounted in every gym in high schools across the U.S., which is about 5,000 square feet for one beam, based on the mounting and how it exudes the UVC and protects all the students and the faculty who are within that one location. And it typically provides 10 plus air changes per hour. And it only consumes the energy of a laptop charger. So really, really sustainable and good for the environment, as well as efficacious. The second installed product is called the Vive. The amazing thing about Vive is this is for both surface and air. So many of our customers use Vive in bathrooms, in kitchens, in nurses' stations, in patient rooms. So this is far UV technology. I should just really, really want to emphasize the installed products are used in occupied rooms. So this is a device that really emits a cone of light continuously, autonomously. None of your staff actually need to interact with this. Real-time disinfecting air and surfaces in rooms up to 200 square feet. So if Dr. Wade and I were in the same room, Dr. Wade had a staph infection, he was patient 0, I would not get sick. If a school was an outdated facility, had mold in the corner, mildew, I would not get sick. This is real-time disinfecting and stopping the spread of the pathogens. And then I want to show you our risk model. So what we do, we have a proprietary risk model, and we take, and this is full access to all of you, we take all of your inputs. So your room dimensions, your targeted ACH, your environmental factors. So this is like your temperature, your movement, the number of people within the location, the type of person. It's all anonymized, but it's based off of an infrared camera. So we can see if it's a doctor versus a nurse, a patient versus a student versus a teacher based on height. And essentially what we do is we take all of those environmental factors and we model the risk for your room. And then what your outputs would be is a percentage of risk reduction, the number of devices that you should have in this room to provide the optimal coverage, risk classification for each type. So we do high, medium, low. For example, if you have an individual office, no one else comes into it, it's not a transient population, you would probably rate that as a low, and it's very low risk. And then we do the before and after air changes per hour. Then we do our continuous risk monitoring and notification with our proprietary software, which is called R0 Connect, and we give you an indoor building health score. And what this allows you to do is understand, based on your occupancy and your environmental data, how the room is performing and what mitigating steps needed to be taken. The devices only run when the room is at high risk or when they need to. So again, it's kind of a secondary benefit that you're using very low energy emitting devices. So really good for the environment, no chemical waste. no high energy costs, but they also only need to run when the room is at high risk. I also just want to note, just again, based on spending a decade in disinfection and cleaning, as Dr. Wade mentioned, we're really relying on manual protocols for much of the cleaning. And so there's such a shortage of staff here in the United States right now. It's very difficult to get both frontline workers as well as custodial and janitorial staff. Many of our customers are actually using R0 devices in replacement of their staff because they can't hire the staff. So school districts don't have the janitorial services they need. They're running about 1/3 less than they were 3 years ago because people have moved. People are making different decisions. So it's really important to be able to use technology to supplement your existing manual labor and make it more efficacious. We have used, we take our efficacy and our data really, really seriously. So we run studies at the Mayo Clinic, with Harvard, with Columbia. We ran with Trilogy Health Services because we want to have studies at a vertical level so that they're applicable to each of you in your own vertical. We also ran at a very large school district. So at the Mayo Clinic, we saw 96 to 99.8% reduction in hard to inactivate, deactivate microorganisms. At Trilogy, we saw an 80% reduction in the surface bacteria that was detected and a 93% reduction in the airborne microbes. And at the top 5 school district, we specifically did this against COVID, given their issues last year when they all returned to school. Many school districts are all still seeing numbers of kids out during cold and flu season, COVID, RSV, which is impacting their absenteeism rate, which is impacting their funding. So they saw 53% reduction in the COVID-2 levels. And then we've also had all of our independent lab studies done, as Dr. Wade mentioned. We have these across all of the microorganisms, from E. coli to MRSA to pneumonia to staph infections, as you'll see. And so we test in real world test conditions so that it's not just academic, but it's brought into the real world. And so what this has resulted in is we're really deployed at scale across 4 industries. So I am focused on healthcare, education, government and the public sector, and commercial real estate. And so this is just the first installment of a 4-part series. We are going to go deep for each one of you in your relevant industries. I'm very thankful to all of you for focusing on using technology, challenging the status quo, looking to see what's possible to keep your constituents safe. And really my role is just to provide education and see how I can help. So I'm going to turn it over to Q&A because I think there are a number of questions. This, of course, is recorded. We're also going to send out the script and the recording to all of you. I would love for you to attend with us over the next 3 installments. But you can see that we're deployed across large hospital systems that you all recognize, whether it's Stanford, Mississippi, Carle Health, education, a number of large school districts, government, LA Parks and Recs, I think really led the charge into making Los Angeles healthy. And then across the workforce, a number of companies that are really focused on bringing their people back together safely and providing, that investment in human capital. We invest so much in our IT systems and our computers. We should really do the same for our most valuable resource, which is our humans.